Ladies and gentlemen, today we are going to delve into the fascinating and challenging field of oncology. We will explore various aspects of cancer, including its definition, types of cancer, oncogenes and tumor suppressor genes, clinical manifestations, tumor markers, grading, staging, and chemotherapy. Cancer is a complex and diverse set of diseases, and it is important to understand its various aspects for diagnosis and treatment. Let's begin with some fundamental concepts. Neoplasm. A neoplasm is any new and abnormal growth, specifically one in which cell multiplication is uncontrolled and progressive. Neoplasms can be benign, non-cancerous, or malignant, cancerous. We will focus on malignant neoplasms, which are commonly referred to as cancer. Hyperplasia. Hyperplasia is an abnormal increase in the volume of a tissue or organ caused by the formation and growth of new normal cells. Dysplasia. Dysplasia refers to the abnormal development, alteration in size, shape, and organization of adult cells. Anaplastic. Anaplastic describes the loss of differentiation of cells and their orientation to each other, which is a characteristic of tumor cells. Mitosis. Mitosis is the process of cell division, which plays a crucial role in both normal tissue growth and the development of tumors. Apoptosis. Apoptosis is programmed cell death, which helps maintain the balance between cell growth and cell death in normal tissues. 7. Proliferation and differentiation. Proliferation refers to the rapid increase in the number of cells, while differentiation involves the process by which cells become specialized in structure and function. Proto-oncogenes, oncogenes, and tumor suppressor genes. Proto-oncogenes are normal genes that direct protein synthesis and cellular growth. Oncogenes are mutant forms of proto-oncogenes, which can lead to uncontrolled cell growth. Tumor suppressor genes encode proteins that negatively regulate cell proliferation. When these genes are mutated, they can fail to control cell growth. Mutation. Mutations in genes can lead to the development of cancer by disrupting the normal regulation of cell growth. Now, let's discuss different types of tumors. Benign tumors. Benign tumors are non-cancerous and are named according to the tissues from which they arise. They typically include the suffix -oma and can progress to cancer or remain benign. For example, lipoma, leiomyoma, and meningioma. Malignant tumors, cancer. Malignant tumors or cancers are named according to the cell type of origin. Common types include carcinoma, arising from epithelial tissue, adenocarcinoma, from ductal or glandular tissue, sarcoma, from mesenchymal tissue, lymphoma, arising from lymphatic tissue, and leukemia involving blood-forming cells. Carcinoma in situ, CIS. Carcinoma in situ refers to pre-invasive epithelial tumors that have not broken through the basement membrane or invaded the surrounding tissue. Metastatic tumors. Metastatic tumors grow at distant sites and are composed of cells that have spread from the primary tumor. These cells resemble the original tumor's cells and behave similarly. Metastatic tumors are treated according to their origin, not the metastatic site. Warburg effect. The Warburg effect is a phenomenon where cancer cells use glycolysis even in the presence of oxygen, aerobic glycolysis. This allows the products of glycolysis to be used for rapid cell growth and is activated by oncogenes and mutant tumor suppressor genes. Types of cancers. Carcinomas. Carcinomas are a prevalent type of cancer originating from epithelial tissues that line various body structures, such as the skin, lungs, and digestive tract. These cancers typically form in the epithelial cell's outer layer, making them the most common form of cancer. Symptoms of carcinomas. 1. Skin changes, such as changes in moles or the development of skin lesions. 2. Coughing, chest pain, or difficulty breathing for lung carcinomas. 3. Gastrointestinal symptoms, including changes in bowel habits and indigestion for digestive tract carcinomas. Sarcomas. Sarcomas are a diverse group of cancers that develop from connective tissues, such as bone, cartilage, and muscle. They often arise in the musculoskeletal system but can occur in soft tissues as well. Symptoms of sarcomas. 1. Bone pain and fractures for bone sarcomas. 2. Soft tissue swelling or pain in the affected area. Impaired movement, particularly when a sarcoma affects muscles or joints. Hodgkin's lymphoma. Hodgkin's lymphoma is a distinct type of cancer that affects the lymphatic system. It is most commonly detected in the lymph nodes, particularly in the neck, chest, and underarms. Unlike non-Hodgkin's lymphoma is characterized by the presence of Reed-Sternberg cells, which are large, abnormal cells found in affected lymph nodes. Symptoms of Hodgkin's lymphoma. 1. Painless swelling of lymph nodes, often in the neck, armpits, or groin. 2. Unexplained fever, drenching night sweats, and unexplained weight loss. 3. Persistent fatigue and generalized itching. Non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma is a broader category of lymphatic system cancers that include various subtypes. It is most frequently detected in lymph nodes, but can also occur in other lymphatic tissues, such as the tonsils, spleen, and bone marrow. Unlike Hodgkin's lymphoma, it lacks Reed-Sternberg cells. Symptoms of non-Hodgkin's lymphoma. 1. Enlarged lymph nodes. 2. Fever, night sweats, and unintentional weight loss. 3. Fatigue and general weakness. 4. Abdominal pain or swelling due to enlarged lymph nodes in the abdomen. Leukemia. Leukemia is a cancer that primarily affects the blood-forming cells in the bone marrow and blood. It is detected through blood tests and bone marrow biopsies. Leukemia is divided into several subtypes, such as acute lymphoblastic leukemia, AL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. Symptoms of leukemia. 1. Fatigue and weakness due to low red blood cell count, anemia. 2. Frequent infections resulting from decreased white blood cell count. 3. Easy bruising and bleeding caused by low platelet count. 4. Bone pain and joint pain due to the overcrowding of the bone marrow with cancer cells. Multiple myeloma. Multiple myeloma is a cancer of plasma cells in the bone marrow. It is often detected in the bones, particularly in the spine, pelvis, and ribs. Multiple myeloma is characterized by the overproduction of abnormal plasma cells, which can crowd out healthy blood-forming cells in the bone marrow. Symptoms of multiple myeloma. 1. Bone pain, particularly in the spine, ribs, and pelvis. 2. Fatigue, weakness, and anemia. 3. Frequent infections and impaired immunity. 4. Kidney problems due to the accumulation of abnormal proteins in the blood. Now let's discuss the signs and symptoms of cancer. Signs and symptoms of cancer. 1. Fatigue. 2. Lump or area of thickening under the skin. 3. Weight changes, unintended loss or gain. 4. Skin changes, e.g. yellowing, darkening, sores that won't heal. 5. Changes in bowel or bladder habits. 6. Persistent cough or trouble breathing. 7. Difficulty swallowing. 8. Hoarseness. 9. Indigestion or discomfort after eating. 10. Muscle or joint pain. 11. Unexplained fevers or night sweats. 12. Unexplained bleeding or bruising. Clinical manifestation. 1. Pain is often associated with cancer, but may not be present in the early stages. 2. The type and intensity of pain can be influenced by fear, anxiety, sleep loss, fatigue, and physical deterioration. 3. Pain mechanisms include pressure, obstruction, invasion of sensitive structures, stretching of visceral surfaces, tissue destruction, inflammation, and infection. Paraneoplastic syndromes are broad presentations of symptoms not directly associated with the primary cancer site. 4. They can often be the first presenting complaint for a cancer diagnosis. Tumor cell markers. Tumor cell markers are substances produced by cancer cells that are found in the blood, CSF, urine, etc. They can be hormones, enzymes, genes, antigens, or antibodies, and are used for diagnosis and monitoring. Grading. Grading is used to classify cancer cells in terms of how abnormal they are compared to normal cells. It helps determine the aggressiveness of the tumor. Grading is typically done on a scale of I to IV, with grade 1 being well-differentiated and grade 4 being poorly differentiated. Staging. Staging helps determine the extent of cancer spread and guides treatment decisions. The World Health Organization's TNM system is commonly used, which involves T for tumor size, N for node involvement, and M for the presence of distant metastasis. Chemotherapy. Chemotherapy is a common treatment for cancer that takes advantage of specific vulnerabilities in target cancer cells. It is usually given in combinations or cycles to attack cancer from multiple angles. Major classes of chemotherapy. 1. Platinum compounds, e.g. cisplatin. 2. Mitotic inhibitors, e.g. vincristine, paclitaxel. 3. Topoisomerase inhibitors, e.g. etoposide. 4. Alkylating agents, e.g. cyclophosphamide. 5. Antimetabolites, e.g. methotrexate. 6. Anti-tumor antibiotics, e.g. doxorubicin. Dealing with chemotherapy side effects. Chemotherapy can have various side effects, including bone marrow suppression, stomatitis, nausea, vomiting, alopecia, anorexia, fatigue, infection, and bleeding. These side effects need to be closely monitored and managed. Extravasation. Extravasation is a potentially serious complication that occurs when chemotherapy drugs leak from the blood vessel into the surrounding tissue. It can lead to tissue damage and needs to be managed promptly. Thrombocytopenia, anemia, and neutropenia. These are common side effects of chemotherapy. Thrombocytopenia is a decrease in platelet count, anemia is a decrease in red blood cells, and neutropenia is a decrease in neutrophil count. These conditions can lead to bleeding, fatigue, and increased susceptibility to infections. In conclusion, I hope you found this lecture on oncology from Wally's nursing videos both informative and enlightening. Understanding the diverse forms of cancer, from carcinomas to sarcomas, Hodgkin's and non-Hodgkin's lymphomas, leukemia, and multiple myeloma is a critical aspect of providing high-quality nursing care. As dedicated healthcare professionals, you play a vital role in diagnosing and caring for patients facing these complex diseases. Your knowledge and compassion can make a significant difference in their journey toward recovery and improved quality of life. Remember, learning and staying up to date with the latest advancements in the field is a continuous process. So whether you're a seasoned nurse or a student just starting your journey, never stop seeking knowledge and striving to provide the best care possible. Thank you for choosing Wally's nursing videos as your source of information and education. We're here to support your commitment to excellence in nursing. Please feel free to explore our wide range of resources and videos to enhance your understanding and skills. Together, we can make a positive impact on patient care and contribute to the ongoing fight against cancer. Thank you for your dedication, and we look forward to being a part of your continued learning and growth.